Alrighty, in this video I'm going to show you how to do this exercise for what's known as hip external rotation. What we're going to be trying to do is this kind of movement with your hip joint, and I'm spinning through my hip here. I'm not just kind of taking my foot across and moving my hip in this direction. I'm not bringing my foot across and then lifting, and I'm going to show you how to do this in a couple of different ways. This first way is going to be laying on your side. So if you can find in your house like a bed or a couch or something where you can achieve this position here, where if you get your hip kind of up to 90 degrees, you can see on this camera here, it's kind of up at 90 degrees, and then I rest my body down. With the other leg, you can put it wherever it's comfortable, if it's up here, if it's down here, wherever you kind of want to put that to get it out of the way and somewhere that's comfortable. Then this movement is going to be, like I was saying, spinning your femur, trying to get your foot up off of the, or away from the ground, but not so much that you're lifting up like this and feeling a lot of muscles working in your groin. So what you really want to do is kind of drive your femur, the upper portion of your leg, down into the table, the couch, the bed, whatever it is, as you then rotate and kind of spin your femur up and around this way, like so. And you won't be able to force too much motion here. It might get kind of difficult, but just getting the motion up to where it's comfortable, you should be able to get some muscles kind of in this area. Back in between kind of the outside bony part of your femur and your sit bones is where most of these muscles live. It's all these little guys. Hopefully you can see that right in here. Hopefully I can line this back up like so. So once again, you just kind of get into a position here, and you're just rotating this up to the ceiling, making sure that your femur stays pushing into whatever it is that it's laying on. Everybody will have different amounts of motion on this in terms of what they can accomplish comfortably. I personally have quite a bit of this movement, but I don't have a lot of movement going the other way. So if you notice, I kind of come down to the plane of the table here. If I go down too much further, I start to feel a lot of jamminess in my hip. You don't want to let gravity just yank you down here too far. You want to actually see where you can control that down to, and then spin up into that motion. So one thing you can do to check how much motion you have is if you're sitting and then you actually try to rotate it the opposite direction. See how that's as far as I can go, which means when I'm laying on my side, I'm not allowing it to go down any further than I assess my ability to move. So here, I'm kind of going down to that point, driving my femur down into the table, and then rotating up and around. It's really easy to try and go too far, to let your leg roll up this way, to try and pick your leg up if you're feeling things in your groin. And again, we should be getting it in this nice kind of outside, what's called the hip external rotator group here. And I'll show you what that looks like right now. So just to give you a quick visual of what you should be thinking about during that hip external rotation exercise, because it's important to make sure you're visualizing the right things inside of your head in terms of muscles that you're trying to use to perform this movement. What we really want to think about is this section of muscles right in here. So if you notice, as we go back to the beginning here and then pause it, I'm going to draw on this for a second. You'll notice this little ridge right here. That's the bony outside ridge on the outside of your hip right here. That's your hip joint. It's the outside of your femur, and here we're looking at it from the back. So we've got the outside ridge of the femur here, and then we've got our sacrum and kind of our sit bone down here. These right here are your sit bones, right there, and your sacrum up here. So what's happening is as you perform this movement and you're laying on your side or you're sitting on a chair and you're kind of rotating that femur and your lower leg is moving inwards, it's actually the movement is known as external rotation. So what we're trying to do is you're thinking about these muscles in here are trying to pull this ridge this way, which is why your whole femur kind of spins in one direction, because these muscles are trying to pull this ridge over towards the sacrum and towards the sit bones. And now as we stop drawing and let that play, you'll kind of see what I'm talking about here. How that rotates over and in towards this area. And here you can see with my cursor, towards the sacrum, towards the tailbone, towards the sit bone down here, as all these muscles, piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and some other ones they don't have pictured, are trying to do that rotational movement. So as you're sitting there on the chair or as you're laying on your side and you're doing this spinning movement, what's happening is this outside part, that ridge that's there highlighted, is traveling down. Even though the rest of your leg is spinning in, that's traveling down towards your sit bones. So we're trying to feel the muscles right in there while we're performing that movement.